Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center. One of the most important topics that we ever cover on this YouTube station is vagus nerve regeneration. And because in our office we actually check the cross-sectional area of the vagus nerves, I can absolutely tell you vagus nerves can regenerate, they can get bigger, and that we're in the process of tabulating data which hopefully will get published in a medical journal. So you feel like you have a problem with your vagus nerve, that you have some vagus nerve dysfunction or vagus nerve degeneration. When we say dysfunction, dysfunction means that the impulses are not going through 100% in the vagus nerve. If you think about what is the electrical supply of the human body, like for cells and tissues to live in the human body, they have to have a good blood supply, right? They have to have oxygen and food and blood supply. But also all the cells and all the tissues, they need a nerve supply. So the main nerve supply, the main electrical circuit in the human body is through the vagus nerves. So the vagus nerves basically go from the brain stem downward, then they go upward with all the information so the brain knows what's going on in the human body. So when the vagus nerves aren't working correctly, their function, they have dysfunction, then the brain isn't really getting the right information on what's going on in the body, so it's impossible for the brain, the central computer, to do what's best for the body. When we say vagus nerve degeneration, it means that vagus nerve cells have died. So the vagus nerve has 100,000 nerve cells, so imagine if 50,000 of the nerve cells died, right? The vagus nerve size would be about 50% of normal. And most of the people that I see, by the time they come here with fatigue, tachycardia, palpitations, anxiety, depression, constipation, bloating, nausea, fatigue, brain fog, all kinds of different symptoms, then usually the size of the vagus nerve is less than 50% of normal. So how does a person go about, like how do they start with getting the vagus nerve better? So I'm actually going to go to the next slide. So you see how we have a lot of people, they monitor their heart rate variability, which I'm going to talk about, but I just wanted to show that. So you can actually monitor how your vagus nerve is doing moment to moment or over time, and that's called heart rate variability. So the things that help heart rate variability is going to be a positive, joyful, loving countenance and how you live your lifestyle. So it's a positive lifestyle versus a negative lifestyle. So that would be that you celebrate victories. Like after I do a really good prolotherapy treatment on the person, I'm like, that was awesome. The prolotherapy treatment was awesome. You know, why do we always have to get emotional about the politics of the nation and this and that? Like, we get so emotional on negative things. Why don't we start being positive and celebrate victories? I actually do that on the golf course when I hit a good shot. And honestly, it helps. I hit a lot more good shots and I get emotional about the positive instead of reinforcing the negative by getting emotional. And obviously, we see how a breakdown in the neck curve damages the vagus nerve. It usually does it at the atlas. So we do cervical correction. And then when our motion scanning shows instability, and that's how you diagnose a breakdown of the neck curve from ligamentous injury, it's by moving the neck and showing motion x-rays or fluoroscopy. And then we do prolotherapy to tighten the ligaments. Once we tighten the ligaments, the bones don't move in a manner that compresses and stretches the vagus nerve. So once the vagus nerve isn't stretched and compressed, of course, the vagus nerve can regenerate. Now, I wanted to mainly talk about heart rate variability. So when the vagus nerve is strong, there's a lot of variability between heartbeats. So when you're stressed out, there's no variability. When you're stressed out, it's boom, 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 boom. There's no variability. And your heart rate's high. If somebody's a calm person, and people would see me at the end of the day, because sometimes I'll mention this to people, like at the end of the day, and you know, I'll see 16 complicated vagus nerve degenerated patients, or the jugular vein, which runs right with the vagus nerve in the carotid sheath, where they're closed off so the people's brains aren't functioning well. So, you know, work 8-9 hours, and you'd see me at the end of the day, it's like, nope, doc's pulse is still 59 to 61, heart rate variability around 70. You know, like that's one of the ways that I can do what I do, is because my heart rate variability is high, vagus nerve function is good. And one way to monitor it, you could have an oral ring, you could have a watch, you know, Apple Watch or some kind of watch or monitoring device that monitors your heart rate variability. You can see what happens during the night, right? During the night, your heart rate variability should be very high. So when your vagus nerve is strong, there is a slower heart rate, so there's more time between heartbeats and more of a chance to get variability. So if my pulse rate's 60, so between heartbeats in average it's 1 second, but realistically it'd be 1.1 seconds, the next one 0.9 seconds, the next one 1.15 seconds. So there's a lot of variability between the heartbeat, and that's from the vagus nerve primarily. So the stronger your vagus nerve, the higher your heart rate variability. So basically, when somebody's vagus nerve health is high or their heart rate variability is high, they can handle so much stress. So if you're having trouble handling stress, it's probably that your heart rate variability is low. This just shows how if you have negative emotion versus positive emotion. So see how the heart rate variability in this study was basically doubled just by having a positive outlook. So why would somebody not have a positive outlook? And then when somebody did resonance breathing, that's the breathing that gets your heart rate variability the highest. So when you're stressed out, you're, you know, real short breaths. When you're relaxed, you're breathing through your nose and you have very slow breathing. So resonance breathing normally is around 6 breaths per minute. So that would look like this. So I'm going to go 5 seconds in through my nose, 5 seconds out. And believe it or not, it's mostly slow exhalation. So if you're going to work on your breathing, it's actually more important to slowly breathe out. So that's resonance breathing. And then I guess we're done.